Lume Energetics presents Understanding Lyme Disease and Associated Co-Infections. Borrelia burgdorferi, the scientific name for Lyme disease, was first identified in the United States in Old Lyme, Connecticut. The disease was isolated from several children who suddenly came down with what appeared to be bad cases of rheumatoid arthritis. Classic Lyme symptoms include bullseye rash, joint pain, fever, and fatigue. Lyme is known as the great imitator. Lyme disease has over 100 possible symptoms. Refer to the ILADS Burrascano Protocol symptom list. Misdiagnoses or syndrome labels may include presenile dementia, Parkinson's, chronic fatigue, fibromyalgia, mental illness, and Munchausen's by proxy. Lida Mattman, Ph.D., was nominated for the Nobel Prize for her work on Lyme disease as a stealth bacteria, an organism with multiple ways to hide from the immune system. Cell wall deficient Lyme L-form can hide inside host cells. Spirochete corkscrew-shaped Lyme bacteria can burrow inside any tissue, including joint cartilage and through brain barrier. Lyme cyst form evades the immune system with a protein barrier. Autoimmune dysfunction and the L-form bacteria. A variety of autoimmune diseases have been associated with Lyme disease, possibly due to intracellular infection with the Lyme L-form cell wall deficient bacteria. Associated autoimmune diseases include MS, lupus, Hashimoto's, Addison's, rheumatoid arthritis, and Alzheimer's dementia. Aggressive, long-term, and innovative techniques must be used to kill Lyme spirochetes in hard-to-reach places, such as synovial fluid and cerebrospinal fluid. The Lyme Borrelia cyst form. When threatened by antibiotics, Lyme spirochetes form into a ball and coat themselves with protein to effectively evade the immune system. Cyst form inhibitors must be used to fully eradicate Lyme, or the host will be reinfected. Problems with Lyme disease diagnosis. ELISA tests are often inaccurate. Lab tests may not be sensitive. Doctors may diagnose a low positive as a negative. Immune exhaustion or sensitivity may result in a negative test, and doctors may be discouraged from diagnosis due to criticism of overdiagnosis or fad diagnosis. Immune alarm and exhaustion. Overwhelming burden on the immune system from multiple tick-borne infections may shut down adequate immune response to extreme or multiple pathogenic invaders. Adrenal hyperarousal and fatigue. Lyme patients often present with very high, very low, or fluctuating cortisol, a stress-related hormone, and severe adrenal dysfunction. Very high or very low levels of cortisol depress the immune system. Biofilms. Lyme and other bacteria secrete and surround themselves with a glue-like substance called biofilm. Biofilm must be eliminated so the immune system can reach the bacteria. Neurotoxins. Many of the symptoms of Lyme disease are from neurotoxin release. Die-off symptoms, or Herxheimer reactions, may be reduced by good detox and drainage protocols. Neurotoxin removal. Neurotoxins recirculate and cause neurological damage unless absorbed by specialized supplements and carried out of the body. Ammonia is a Lyme neurotoxin and a byproduct of co-infections including parasites and molds. Die-off of Lyme in the brain and spinal cord results in high brain levels of ammonia. Symptoms may include anxiety, anger, and depression. Mercury and metals. Lyme may attach to mercury and release mercury into the body when it dies. It is important to assess regularly for increased metal levels and treat as necessary. Lyme disease infections of the mouth and jaw are common. It is usually necessary to remove all silver-colored mercury amalgam fillings to completely heal from chronic Lyme disease. Mosquito-borne pathogens. Borrelia is commonly considered a tick-borne pathogen, but has also been found in mosquitoes. Co-infections, such as West Nile virus and equine encephalitis virus, may be found in mosquitoes as well. Lyme disease co-infections. Common co-infections of a Lyme-infected tick bite include Bartonella, Babesia, Brucella, Ehrlichia and Rickettsia, and encephalitis viruses. Opportunistic co-infections. Lyme disease stresses the immune system and makes the host susceptible to a variety of additional infections, often several at once. Common opportunistic infections include herpes viruses, cytomegalovirus, streptococcus, Klebsiella, Mycobacterium tuberculosis, and macroparasites in worms. Parasites in worms. Macroparasites, a worm with its own digestive tract, may harbor Lyme and other infections. It is likely that most people carry some form of macroparasite without obvious symptoms. Aggressive removal of parasites should take top priority in Lyme treatment. Parasites raise ammonia levels in the body and stress the liver's ability to detox Lyme toxins. If parasites persist after Lyme treatment, they may reinfect the host patient with Lyme and co-infections. Bartonella. Symptoms of Bartonella include a rash that looks like brown stretch marks, often found under the arms or on the back. Bartonella secretes a substance that depresses the immune system, making it difficult to overcome the Bartonella, Lyme disease, and other concurrent infections. Babesia. Babesia is a microparasite similar to malaria. It is a protozoa that infects red blood cells. Symptoms include fatigue, fever, and air hunger. Rickettsia. Rickettsia is an intracellular bacteria that includes a variety of strains including endemic typhus, Ehrlichia, and Rocky Mountain spotted fever. Symptoms may include a rash of small non-raised red spots. Tick-borne viruses. Ticks may carry a large variety of viruses, many of which have a tendency to cause encephalitis meningitis. Tick-borne encephalitis virus, known as TBEV or FSME, is one of the more common viral strains. Symptoms include extreme fatigue, brain fog and confusion, difficulty with word search, and neurological and endocrine dysfunction. Candida is a naturally occurring yeast in the human body. Antibiotic therapy often causes dysbiosis, candida, and systemic fungal overgrowth. Candida and Lyme. When Lyme dies, it may release mercury it has been bonded to. Mercury supports candida growth. Symptoms of a severe candida infection are often similar to symptoms of Lyme disease because they both produce neurotoxins. Yeast and mold. Systemic yeast, mold, and fungus have similar symptoms to neurological Lyme disease because they all produce neurotoxins. Lyme patients living in a house with mold often develop serious systemic mold infections due to compromised immunity. Systemic mold and fungal infections often go undetected and untreated or are exacerbated by antibiotic treatment. CDC Lyme treatment. The Center for Disease Control provides the medical community with the accepted standard of care for Lyme disease. The CDC Lyme treatment protocol is up to 4 weeks doxycycline for adults or amoxicillin for children. CDC protocol requires no co-infections testing. The CDC does not recommend additional treatment unless there are neurological symptoms and a positive ELISA and Western blot. Exceptions are now legal in Connecticut. Any remaining symptoms are labeled post-Lyme syndrome and are considered untreatable. ILADS Lyme treatment. International Lyme and Associated Diseases Society doctors are referred to as LLMDs, or Lyme Literate Medical Doctors. They are widely recognized as the medical experts on Lyme disease. The ILADS protocol includes several months to several years of multiple antibiotic oral and/or IV treatment for Lyme and co-infections. Several ILADS doctors have had their medical licenses threatened for working outside of CDC protocol. Chronic Lyme is the term given to those who remain ill for longer than 3 months, even with antibiotic treatment. Chronic Lyme diagnosis. Without a recent tick bite and/or obvious bullseye rash, hunting for a diagnosis for a mysterious group of symptoms may become frustrating and expensive. Those with chronic Lyme are often known to have spent more than $50,000 out of pocket on various medical diagnosis, treatments, and procedures while seeking a cure for their condition. Lyme disease and politics. Insurance companies may lose money from approving long-term treatment of a disease at epidemic proportions. Pharmaceutical companies may benefit from selling prescriptions that provide symptom relief only. And business factions may lobby lawmakers in favor of financial interests rather than interests of Lyme patients. Patience and persistence. Chronic Lyme disease takes time and patience to overcome, but regaining your full health is possible. Excellent Western and alternative healthcare options are available to the educated Lyme patient. Some alternative treatments are no more than an attempt to take advantage of the vulnerable. Many highly effective treatment alternatives have been denounced as quackery by professional bloggers employed by pharmaceutical companies to protect profits. Educate yourself. Be aware that misinformation abounds. Choose your options carefully. Seek accurate information and positive outcome reports from local and our web-based Lyme support groups. Lume Energetics LLC is dedicated to Lyme education and awareness, scientific research of Lyme care alternatives, and delivering reliable, effective, and affordable Lyme assessment and healthcare solutions to the Lyme-affected community. Thank you.